Neonatal Care Part 10. Now we're going to talk about cyanotic diseases. Cyanotic diseases occur when there is a right to left shunt. Deoxygenated blood from the right side of the heart mixes with the left side. Pulmonary stenosis. Pulmonic valve near the right ventricle becomes damaged. The patient will have a decrease in blood flow to the lungs and will present with JVD, cyanosis, and right ventricular hypertrophy, typically associated with congenital heart disease, but can also result from rheumatic heart disease. Truncus arteriosus, the pulmonary artery and the aorta are combined into one vessel, which is seen right here. Hypoplastic left heart syndrome. The left side of the heart is completely underdeveloped. So you don't have a developed left side of the heart. A heart transplant is necessary to resolve this issue. Tetralogy of Fallot. It's a combination of 4 heart defects: ventricular septal defect, pulmonary stenosis, right ventricular hypertrophy, and an overriding aorta. Most infants are pink at birth because they usually have a patent ductus arteriosus that provides additional pulmonary blood flow. As a ductus closes in the first hours or days of life, cyanosis may develop or become more severe. Clubbing occurs as pulmonary stenosis becomes significant. Blood flow to the lungs is reduced, and a characteristic murmur is present after the first few days. When arterial oxygen saturation suddenly decreases, an infant or child may experience what's called a tetralogy spell or a TET spell. Also called TET spells, hypoxic spells, hypercyanotic spells, or blue spells. Usually results from sudden increased constriction of the outflow tract to the lungs. Child becomes increasingly cyanotic and irritable, breathes deeply and rapidly, syncope, seizures, stroke, or death if left untreated. And it often occurs in the morning after crying, feeding, or bowel movement in infants. Management should be to keep the infant or child as calm as possible. They should be picked up and held in a knee-chest position to allow for better circulation. Older children often squat to recover. Give oxygen, IV fluids, and medications as ordered by medical direction. This will require open heart surgery for corrective treatment. Transposition of the great arteries. Positions of the pulmonary artery and the aorta are reversed, so blood goes to the lungs for oxygenation, then returns to the lungs, while blood from the body to the heart goes back to the body without becoming oxygenated. This will require surgical intervention. Total anomalous pulmonary venous return. The 4 pulmonary veins connect to the right atrium instead of the left atrium. This results in pulmonary overcirculation due to excessive blood return to the right side of the heart, and patients will present with signs and symptoms shortly after birth. The assessment and management of these congenital heart diseases. Rapid detection and transport are mandatory, and communication with medical control is crucial to have adequate services available on arrival at the emergency facility.